so that there isn't mass panic. And perhaps a member of this team could be part of that task force to ensure that whether it's in the news, by social media, or to these hospitals, we have the right communications channel to be able to make sure that the public does not have mass panic.
Thanks, Matt.
I was just going to, I'll add to that in as much as the value of a centralized convening body that is addressing both the production and supply chain also serves as a convening enterprise around the communications. Because there is a lot of great data that's been collected, but probably more can be done from a public education perspective around containment, prevention, while the supply chain is managed.
Yvonne?
I just want to echo Matt's point, and my question here is, what's happening around the world? While we know that there are cases here in these few countries, what's happening to the rest of Asia? What are governments doing to assure the people, and this will help to relax some of the stress that you see in terms of people hoarding personal protection equipment. So I think it requires a global coordination and not just at the individual country-specific level.
Yeah, Brad?
Yeah, I just wanted to comment on Christopher's scarcity comment. It's not just scarcity, it's also severity, and that's why we see different rates of fatalities, 5% to 3%. And there seems to be a stakeholder maybe missing here, and I may be wrong, but is the provider, and who's taking care of these patients? Because there's definitely discrepancies here on fatality rates. We know in panic, in psychology of panic, people start hoarding. People start freaking out and wondering, what should I do? And then countries start doing it, and then there's all kinds of dysfunctional decisions made. Providers really need to be at the table talking about how they're taking care of the patients and diagnostics and what they're doing with it, because we're jumping to a little bit of a conclusion that this is going to spread everywhere to the same degree. And this leads to hoarding, and I'll share with you in SARS, N95s, there's still N95s sitting in boxes that were never used. I mean, the hoarding of that was atrocious. I mean, and then there were knockoffs of N95s that really weren't truly impervious masks that were made and then distributed. So I think there's a need to have the providers in the discussion to see really what they're doing to treat the patients. How severe is the epidemic?
So just on severity, it's important for you all to know that the estimate from our team and from other ministries of health is that the distinctions in case fatality rate represent distinctions in data collection, not that the disease is any different. It looks like the virus is the same around the world. These are different healthcare systems, different data collection, different surveillance. So overall, our all-in case fatality rate is somewhere in the order of 7% to 10%. It depends on where we are in the world. And in terms of where the disease is in the world, we see lots of blank spots, and we think that's partly or largely due to surveillance systems and the slowness in collecting this data in certain parts of the world. We expect that to come online quickly.
Absolutely.
Steve, and then Avril, you haven't had a chance.
No, Steve.
Go ahead, I think you haven't had a chance.
Okay, sure. I mean, I think it's just in terms of the precise question being asked, it's clear that having everybody go on their own is not going to be the most effective answer, right? So I absolutely agree with the comments that have been made that we need to have some kind of international mechanism for coordinating what it is that we would be doing, also for collecting information, also for understanding what the resources are that are available through international mechanisms to execute on that allocation and coordination. I think it's challenging to set it up in a way that says that international mechanism has to be the body that decides in all circumstances what the allocation is. In other words, I think states are going to want to be able to decide for themselves on, in some circumstances, some of the issues that are relevant. So one of the challenges will be ensuring that you're using an existing mechanism, and I think Sophia's right about the UN as being sort of the base of operations in a sense, both for the funding, but also for a whole series of other issues that you would be looking at for allocation, coordination, et cetera. But then making sure that states are stepping up to actually tell people what it is that they're doing, what their decisions are in that context, and creating transparency about what the proper allocation should be for containing this issue so that there can be pressure put to bear on ensuring that states are actually doing what the larger plan needs to be in that context.
Can I ask a follow-up question? If there is a centralized stockpile developed, either at the WHO or perhaps somewhere else in the UN system, if you were going to suggest that, or some other entity, how much can you imagine states contributing of the supplies that are being made in their own countries? Is this a 1% allocation, 20% of the supply that they're making? We've already heard from George that China's not making nearly enough medication to take care of China at this point. So what is the desired end state here? Can you, from a state security perspective, if someone who's worked at the top of government, what do you imagine states who have this medication doing?
I mean, I think the percentage will depend on the details, right? And what it is that you're capable of actually producing in the context of the particular crisis. And I don't know how much we're able to produce under this circumstance. I think there should be, and there would be, from a public perspective and a public health perspective, right, enormous interest in promoting an allocation to international efforts that would actually contain the issue as quickly as possible, right? And that should be the focus for everybody, in the sense of that's what's going to actually help you prevent the downstream impact of what the trajectory holds for us. So the question is, can you, through this international mechanism, really promote commitments to doing this as quickly as possible and give people a sense that actually if they contribute more, that they will have a better chance of protecting their own populations and their country's security.
Okay. Another number of comments. You all just jump in.
Yeah. So thank you. So to be completely clear, most of this production would already be committed in contracts.
Yes.
It is almost unheard of that people are producing product without having a forward commitment for the consumption of that product. So the first thing that needs to be done, because this is not something that the countries currently control, unless countries are going to bring about emergency situations and co-opt an existing supply chain. So the first thing to do is to figure out where that's going. Now, in H1N1, in a number of cases, so the Australian government, we bought vaccine to the extent we could get it, and in some instances we actually gave some of that vaccine. We actually gave some of that vaccine to the United States, who actually ended up with a supply shortage at that particular point. So inconsistent with working out where the biggest vulnerabilities are, the first thing you need to do is figure out who's got control of those supply chains and those products, and then figure out where, for the greater global good, it should be deployed. But we need to be clear. Any government who says, I'm going to ship every single dose of a particular product offshore is going to end up with a challenge domestically. So giving governments the capacity to manage both their domestic concerns together with being good players. And we know from the PIP framework that companies will similarly contribute, but it's got to be in an organised framework.
Okay.
And that challenge, I think, is being proved out with the increasing rhetoric, both by candidates in the US, UK, and Germany, who are saying that globalism is responsible for this pandemic, and therefore there's a rising protectionist nature to take care of their own. And so I think it's an instance where the business, health, and scientific communities need to combat that rising rhetoric and misleading information.
Yeah, and last couple of comments here. We have about 2 minutes before we have to close.
So I think one thing that's going to be very important is to define the aim of using the countermeasure. And from what we know right now, it doesn't seem likely from the data we've had presented that this countermeasure is going to suppress transmission, is going to lead to containment. So
yes,
our aim really would be to minimize the severity and to prevent death rather than to prevent this emerging pandemic. Second thing I wanted to say is just how important communication is, and that is true to the public. This is a very alarming situation, and I think public communication shouldn't be alarming, but should be truthful about how severe it is. I think also internally, as negotiations are going on to share countermeasures, I think it's not likely, I agree, that countries are not going to buy a countermeasure to put into a global supply without retaining a large portion of it for themselves. The last thing I'd say is this is a very dynamic situation. Countries will be negotiating with manufacturers, and I think that's got to be figured into whatever agreement is reached. And whatever that sharing agreement is, it won't be perfect, and I think it's just got to be done quickly so that sharing can actually take place rather than trying to get something that's exactly the way everyone wants it.
And do you think that governments are going to need to break contracts, have companies break contracts in order to redirect antivirals?
I think that would work best for the countries to make the decisions with the countermeasures that they purchased.
Okay.
I think that's a very, we're not talking about one supply chain, but we're multiple supply chains here. And I think, before we start talking about companies withdrawing antiretrovirals from patients with HIV who have a disease, we need to really understand how those ARVs will be used in patients who may or may not have a disease. So demand forecasting will be critical. And I also want to point out it's not just the healthcare workers. We have supply chains in middle-income countries. Often those are very resource dense, people in small spaces producing masks. We have to think about the integrity and the health of the supply chain.
Okay.
Going back
yes.
to Stephen's note real quick about the public communication, my team has been monitoring the public response, and on various social media channels and cable networks, there's been some conspiracy theories that are around about the potential that pharmaceutical companies or the UN have released this for their own benefit. So as we move forward, obviously trust in pharmaceuticals and government is very important at this moment. And so as we move forward with developing the right scenarios, we have to make sure that the public communication is a major part of that because of these conspiracy theories.
Thank you. We have to close. We have 30 seconds.
Okay,
Yeah,
but
Mark.
this fully supports Steve's input. We should not search for the perfect solution right now.
Yeah.
We run against time. And if conspiracy theories like this come up already, so we are on the edge of hysterical reactions, and then it gets out of control. And that's the thing what should be the main driver for us now to find a solution.
Okay. Okay. Thank you. We're going to bring these recommendations together and communicate them broadly at the conclusion of this meeting. Thank you all for your input. We will conclude this meeting and we'll reconvene shortly.
Yes, and that does conclude the first meeting of the board.